Welcome back. Hope you are safe and doing good. Today we have a nutritional expert with us who will be giving some tips how to boost the immunity, and also I'll be discussing very shortly what is convalescent plasma therapy and whether this treatment can be considered as a potential treatment for COVID-19 or not. So stay tuned till the end of the video. Myself Kamal and I'm watching Healing Physios.
Healing Physios. Your health, our health.
We all know that we have immune system in our body to fight against viruses and bacteria. Whenever our body is being attacked by any virus or bacteria or any kind of pathogen, our immune system will produce antibodies and will help in fighting against these viruses, bacteria or pathogen. Suppose for example, A has got very good immunity whereas B has got poor immunity. Now suppose both of them are infected with COVID-19. Now both of them will develop immunity and produce antibodies to fight against this novel virus. Now as A has got very good immunity, so he will produce antibodies and he may get recover early. Whereas B has got very poor immunity, so he may or may not get recovered early as like A. The concept is that if the immunity from A can be transferred to B, can B be recovered early as like A? In simple way, the immunity that has been produced in the body by A over the time, if this can be transferred to B, can B be recovered early as like A? Can we say B?
So guys, in this topic I'll be discussing very shortly what is convalescent plasma therapy, whether this treatment is going to be effective or not, what are the clinical trials or studies going on, and what are the challenges or drawbacks. Plasma is the largest component of the blood, making it almost up to 55% of its content. It helps in carrying nutrients, hormones, enzymes, most importantly immunoglobulins, antibodies, albumins and many more. So whenever an individual donates a blood, health professionals can easily extract this plasma out of it. So convalescent plasma therapy means transferring of plasma from a healthy survivor to a sick patient. Here the plasma is being extracted out from blood from a healthy survivor and it is being transferred to a sick patient. So in aspect of COVID-19, in simple way, in this procedure, the blood is being drawn out from a recovered COVID-19 patient, and the serum is being separated and they screen out the antibodies which was produced over time by the body, which is helpful in neutralizing these viruses, and this serum or this plasma is being transferred to critically sick patient or critically ill COVID-19 patients. So I'll be discussing very shortly first clinical trials, secondly research is going on, thirdly criteria for donors and receivers, and fourthly challenges or drawbacks. Guys, a study was done in China in which they have taken 10 patients. All of these patients were critically ill and they were adult. So they have administered 200 ml of plasma, and out of these 10 patients, 7 shows improvement with disappearance of virus. Similarly, a study was carried out in China by Sen et al. In which they have taken 5 patients. Out of which 4 of them received convalescent plasma on the 28th day, and 1 received who have cardiovascular problem too. He received on the day of 10th day. And after 7 days, there was significant improvement in decreasing body temperature, normalization of PF ratio, and also improvement in sequential organ failure. The limitation of this study was that all of these 5 patients were receiving antiviral as well as steroid treatment too. So it is very difficult to identify whether this improvement is because of plasma or because of antiviral treatment. Similarly, in the past outbreak like Ebola, SARS, coronavirus, MERS, whose symptoms are similar to coronavirus, several studies were done and significant improvement was found using convalescent plasma therapy. Okay, who can donate this plasma? Okay, or what are the eligibility criteria for donor? Okay, first they should be COVID-19 survivor. Second, they should be test negative in 2 consecutive days. Okay, they should be free from coronavirus in 2 consecutive days. After that, they will be put in isolation for 14 days, and if there is complete resolution of symptoms within these 14 days or 28 days, they can donate. Okay, now according to the guidance given by FDA, patients who can receive this plasma or convalescent plasma under clinical trial, first, the patient should be very critically ill. Okay, second, having dyspnea whose respiratory rate is more than equal to 30 breaths per minute. Okay, having PF ratio less than 300, having blood oxygen level less than equal to 93%. Okay, if this criteria is fulfilled, they can receive convalescent plasma under clinical trial. This plasma or convalescent plasma therapy has not been yet approved by FDA, Food and Drug Administration, and they has provided guidance to the healthcare providers and also the investigators to study the safe and efficacy in treatment of COVID-19 patients. Okay, under only in clinical trials. So after getting approval from the FDA, okay, Indian Council of Medical Research, they have uploaded a proposal, or they have given a proposal inviting all the healthcare professions or healthcare institutions, also healthcare providers, to participate in these clinical trials. Okay, over ICMR, Indian Council of Medical Research, makes it very clear that it does not recommend plasma therapy as a treatment outside clinical trial setting. Okay, Kerala is the only state in India to participate in this clinical trial, which involves transfusion of plasma therapy or plasma, okay, convalescent plasma from a recovered COVID-19 patient to a critically ill patient. Okay, challenges in plasma therapy. Okay, first, there can be many side effects like fever, allergy, bronchospasm, lung injury. Okay, circulatory overload in cardiovascular problem with patients. Okay, then the patient should not have any kind of respiratory infection. Okay, at least 3 months prior to donation. After all these studies, one can definitely say that yes, convalescent plasma therapy can be an effective option in treating COVID-19 patients, but it is very, very unclear whether this therapy or this plasma can be transfused to all the patients with all age group, keeping in mind their comorbidities. It's very unclear whether the plasma should be administered early in the treatment or later. Secondly, is alone plasma therapy is effective, or it required combination with other treatment like antiviral or antimalarial treatment. Okay, so guys, let's hope for the best. Guys, now a nutritionist is going to give some tips how to boost your immunity. Okay, so let's start.
Hi everyone, my name is Angana Goswami and I'm a nutritionist. So this is a very crucial time for all of us. So I'm here with some of my tips to boost your immunity system, because this is the only way we can fight against the virus besides of taking the preventive measures we are taking right now. First one is tulsi leaf, which is very easily available in your locality. You can have in the morning time, like with tea, you can have it. And the second thing is chawanprash. Whether you are in a weight gain program or in a weight loss program, there is no issue with that. You can easily go and have it. That will help to rejuvenate your tissues in the body. And the third thing I'd like to suggest is that turmeric latte. You can go for turmeric latte. You can add 1 teaspoon of honey along with that. That will be a good immunity booster for your body. And one very important thing, that is your sleep pattern. So I would suggest you guys to sleep early, have a very light dinner so that your digestive system works properly in this period of time, and you get enough of sleep to fight against the virus by improving and raising your white blood cells in your body. So these are the 3 very simple ingredients that I have mentioned. Hope you like this video, guys. Stay safe, stay home.
If you guys like my video, if you like my video, press the like button, share it, subscribe it. Till then, stay safe. Jai Hind, Jai Assam.